Welcome. In this section, we will briefly go over general risk factors associated with increased risk of work-related injury and illnesses among immigrant workers. So the main factors associated with increased risk of work-related injuries and illnesses and/or abuses among immigrant workers include language and cultural barriers, lack of access to healthcare, being a female, documentation status, and political climate. In the next few slides, we'll be going over each one of these factors. So the first risk factor that I mentioned was language and cultural barriers. While safety trainings are key for total worker health and well-being, they may often not be offered in the worker's native language, owing to the wide range of linguistic variation among immigrant workers. Safety trainings, posted safety information and warning signs, and legal information do little to protect workers if workers aren't able to understand them. Additionally, if available in the worker's native language, it may not be appropriate for the worker's education level. Also, factors such as social position or other cultural issues may impact how workers receive trainings presented by other workers, even if they speak the same language. The other risk factor has to do with lack of access to healthcare. Immigrant workers often lack access to healthcare due to their precarious employment, poverty, lack of documentation, or limited knowledge of the health insurance system in the United States. Insurance coverage for medical expenses is one of the most significant barriers to accessing healthcare. Another barrier is difficulty accessing medical care, as workers may live in isolated, rural areas and may not have reliable or safe transportation to seek proper medical care. In addition, long working hours that may include weekend or even night shift work make it hard for workers to access medical providers during standard operating hours. Many immigrant workers also report that they are unable to communicate with medical providers and that there is a lack of access to interpreters. Medical providers may also lack knowledge and training in how workplace exposures could play a role on health. Lastly, constant mobility of some workers who move from one seasonal job to the next can cause discontinuity of care. So what happens when there are numerous barriers to healthcare among immigrant workers? Well, individuals present with advanced healthcare problems, the ultimate cost of treatment is higher, the outcomes of treatment are significantly poorer, and morbidity and mortality rates are higher. The other risk factor that I wanted to mention is being a female. Females migrating abroad for work often face higher health risks than their male counterparts, as well as differences in mental health outcomes, cancer rates, occupational injuries, and reproductive health, which have been documented in the literature. Among U.S. farm workers, for example, women make up about 28% of the workforce. Women farm workers are reported to have higher rates of stomach cancers than men. Additionally, exposures to pesticides during the preconception and prenatal period are also reported to impact reproductive health, including birth outcomes, and to impact children's health, including poor neurodevelopment. Women workers also encounter barriers to reproductive health associated with healthcare costs, as well as proper access to health insurance or childcare. It has also been documented that immigrant women often underutilize family planning services, delay prenatal care, and have more unplanned pregnancies than do native-born women. Migrant women may also be at a double disadvantage of discrimination in the workforce because they do not only have to navigate their roles as immigrants, but also they're subject to gender inequality as these workers earn less than immigrant men and native-born women. Females may also migrate as partners, following the work of their partner. This creates an economic dependence on their partner and predisposes women to suffer from intimate partner violence. In addition, this status as a partner migrant may be used as a rationale by employers to pay lower wages or provide fewer rights. Documentation status is another risk factor placing immigrant workers at an increased risk of work-related injuries and illnesses and abuses among immigrant workers. One study conducted among 4,000 workers in low-wage jobs across several large U.S. cities, including New York, Los Angeles, and Chicago, found that undocumented workers were more than 2 times as likely to experience wage violations versus documented workers, and they were also less likely to make formal complaints about workplace safety violations because they feared losing their jobs. Undocumented workers employed in hazardous jobs also have no recourse due to the threat of deportation. They are also reluctant to leave these jobs due to fear of not finding another form of employment. Additionally, they are often ineligible for services such as medical insurance or getting a driver's license. This in turn leads to increased vulnerability and social isolation. Moreover, the visa structure in the United States leads to systemic vulnerabilities and makes it harder for workers who work in dangerous and hazardous conditions to leave their jobs. It's important to note that the political climate of the receiving country can also be another risk factor that can impact immigrant worker health and safety. For example, when the receiving country adopts a position of xenophobia, this places the rights and health of immigrant workers at risk. One study conducted in Michigan reported that raids by immigration officials led to worse self-reported health outcomes and poor mental health. Increased Border Patrol activity can also limit healthcare access, as many workers cross the border to access healthcare in their country of origin. This can further increase social isolation. In addition, macroeconomic factors emphasizing low prices and global availability of goods perpetuate dangerous working conditions in low-wage jobs and accompanying health risks. The geopolitical context of the host country also creates public health barriers, including on the testing and treatment of sexually transmitted diseases across the globe. Now, there are some approaches aimed at improving the health of immigrant workers and reducing disparities between immigrant workers and non-native workers. These include, for example, training and public health messaging. Improved safety training and public health messaging via different modalities that are culturally appropriate can educate and train workers. These can include pictograms, radionovelas, which are melodramas or soap operas on the radio that could be on any given workplace health and safety issue or another public health topic, comic books, and using social media to educate workers. These modalities have been widely used in select worker populations, including farm workers. Careful attention, however, should be paid to literacy level of the educational content as well as the language in which it is provided to ensure that the educational material and messaging reach the target audience. These trainings in public health messaging can be expanded beyond the workplace and include partnerships with local community centers and organizations to reach wider audiences. This can also include reaching and training medical providers so they're more aware of what health issues may be more prevalent among immigrant worker populations and how the workplace and social structure in immigrant populations may impact health. There are also occupational health and safety research centers across the nation and different universities that offer occupational health and safety training materials in different languages for select populations, and the Occupational Health and Safety Administration also has some training materials for select worker populations. Another approach includes policy changes and agreements between governments. For example, through collaborations between origin and host countries, the International Labor Organization, or ILO, seeks to create agreements that promote the safety of workers. Some of the proposed standards include policies to protect against forced labor or trafficking, making sure that wages are regularly and directly paid to the worker, protecting Social Security benefits, promoting employment contracts, and providing a mechanism for workers to register violations of fair practices at the workplace. Another approach includes expanding the role of non-governmental organizations to improve and ensure worker rights. For example, the Migrant Clinicians Network is a global nonprofit organization that provides support, technical assistance, and professional development to clinicians in community health centers, health departments, and other healthcare delivery sites. As part of many of their efforts, the Migrant Clinicians Network utilizes community health workers to spread education to people employed in high-risk occupations, including migrant workers. Another approach is that of ensuring fair recruitment policies. The vulnerability of international migrant workers starts in their country of origin with predatory recruitment practices. Workers traveling to other countries are often required to pay high recruitment fees to the agency or person assisting them in migration, and it is hard for those paying the fees to ensure whether the agency or person they're paying are legitimate. When these fees are exorbitant, workers may be forced to trafficking or servitude to pay off their debt. So in summary, most immigrant workers in the United States come from Latin America. U.S. guest worker programs often fail to protect workers, leading to perpetual systemic abuse cycles. Abuses in the recruitment of foreign workers are endemic, and they lead to documented cases of debt peonage, human trafficking, and forced labor. Immigrant workers also unfortunately face many public health challenges and risk factors that place them at an increased risk of injuries, illnesses, and abuses in the workplace and beyond. Risk factors that impact immigrant worker health and safety include language and cultural barriers, lack of access to healthcare, being a female, documentation status, and political climate. So while approaches and programs are in place to improve worker health and safety in select immigrant worker populations, challenges still remain, and there is still more to do. Immigrant workers are treated as disposable commodities, and because of the nature of their jobs being seasonal, temporary, and hidden from the public eye, it's hard to reach certain immigrant worker populations and ensure their total worker health and safety.